going with unconscious. So first thing that we're going to do, right, you're going to walk in and we're going to say, you walk into somebody who's blue in a room. First thing you're going to do is safety BSI. Next thing is, are you okay? One hand on the forehead, one hand on the shoulder. Are you okay? You all right? No response, right? Next thing, check for normal breathing. There's going to be no normal breathing, so you're going to call for help, right? ALS. Next thing is you're going to check a pulse. There's going to be a pulse, right? So now they're not breathing. Make sense? So what are you going to do? You're going to attempt to ventilate. So you open the airway and give a breath, right? It doesn't go in. So what are you going to do? Reposition the head, because the most common airway obstruction is the tongue. So you reposition, you attempt to ventilate again. It still doesn't go in. You now know it's a foreign body airway obstruction, right? Notice, did I check a pulse? I did, right? And there was a pulse. And I'm going to move on to do what? I'm going to start compressions. But this case, I'm doing compressions to do what? Move the object out. So I'm going to initiate 30 compressions. After 30 compressions, remember it's CAB, after 30 compressions I'm going to look where? In the airway. I don't see anything. What am I going to do? Attempt to ventilate. It doesn't go in. Reposition, attempt to ventilate, still doesn't go in. Go back to the 30 compressions, right? After 30 compressions, again, look where? In the airway. You don't see anything. Attempt to ventilate. It doesn't go in. Reposition. Attempt to ventilate. One breath has gone in. Now what? Give a second ventilation. After 2 ventilations, now what are you going to do? Check a pulse. Right? There is a pulse. They're not going to be breathing. You're just going to have to do what? Rescue breathing. 1 breath every 5 to 6 seconds. Right? Because now it's an adult. Questions on adult foreign body airway obstruction, unconscious. Notice it's the same sequence for CPR, right? Until you realized you weren't able to ventilate. And then you went to what? Compressions, but this time to try to relieve the obstruction. Pretty good so far? Adult CPR. Adult CPR. You're going to have to set up you're going to work in pairs, right? And now one of you needs to set up the O2 tank and the oxygen regulator, set it up to 15 liters, right? That same person is also going to manage the EMT. Okay. Second person, their job is just to do compressions, if appropriate, if necessary. So once the O2 tank is set up, the oxygen regulator is flowing at 15 liters, and the BVM is hooked up appropriately and is running and working, right, we'll tell you to shut off the oxygen. And from there, you're going to be on scene. First thing you're going to do is, again, one hand, so scene safety BSI, one hand on the forehead, one hand on the shoulder. Are you okay? You all right? No response. Next thing is check for normal breathing. There is no normal breathing, so you're going to call for ALS, right? Check a pulse. No pulse. Begin CPR. Your partner is going to initiate compressions. They're going to do 30 compressions. While they're doing the 30 compressions, you're going to size the what? The OPA. You're not going to insert yet, you're just going to size. After the 30th compression, first thing you're going to do is do what? Look in the airway, just in case this is a what? A foreign body airway obstruction. Make sense? Next thing you're going to do, right, is you don't see anything, so you're going to insert the OPA that you already sized and give what? 2 breaths. Because this is pure and simple CPR, you will be successful with the breaths. Remember to open the airway appropriately, so you may have to do what? Head tilt, chin lift, but we need to see you really ventilate the patient, right? We're not going to make it so it's impossible for you to ventilate. After 2 breaths, what are you going to do next? Your partner goes back to the 30 compressions. While your partner's doing that, you should take the EAD now and do what? Open it up. Don't turn it on yet. Just open it up and start to apply the pads, right? Correct placement is important. You must place one, right, under the right clavicle, and another one lateral by the axillary area on the left side, okay, right under the nipple line area, okay. What are you going to do next? You place those. It's probably around time to do what? Time to ventilate. Give your 2 breaths. Your second cycle has been done. Third cycle is being initiated, right? Again, notice we haven't turned on the machine yet. We haven't plugged in the electrodes yet. We just placed the electrodes. If you're a little bit later, you're not able to put the pads on right away. It may take you a couple more cycles. That's fine, right? You keep on doing this until the 5th cycle. On the 5th cycle, right, after you've delivered your 2 ventilations for the 4th cycle, turn on the AED, but don't plug it in yet. It will run its self-test. By the time your partner finishes the 30 compressions, it's time for you to do what? Give 2 ventilations, then plug in the AED. Does that make sense? Then plug in the AED. Once it's plugged in, right, it's going to say analyzing heart rhythm. Do not touch patient. Time for you to switch positions. Airway person, move lateral to the patient, right, and person who's doing compressions now goes to the airway position. Remember that where should you have placed your AED? On the left side of the patient, right up by their ear. Okay? It's going to analyze, it's going to say shock advised, charging, right? And it's going to start to beep. It's time for you to say, and it's very important, notice it is a pass or fail, right, on your station sheet. If you don't say, I'm clear, you're clear, everybody clear, right? Press the button, and after you press the button, remember, it's the same person who put the AED on, also the same person ventilated. After they press the button, they immediately do what? Initiate compressions. Make sense? At that point in time, the scenario will end, the examiner will say, you can stop, relax, and then switch out. So what you would do is put everything away and start again. Now you're going to start in different roles. The person who was doing the AED and put their O2 tank together is now going to just do compressions, and the person who was just doing compressions is now going to do, right, the setup of the oxygen tank and using the AED. Okay? In the exam, they must see all 5 cycles. They are testing you each time you do the cycle. The point of testing you is airway person, they must see ventilations, administered 2 ventilations. Compressor, you must be able to compress, right, 30 compressions in 18 seconds. They're looking, each time you do it, the first cycle, they're looking at your depth of compression, right? Your second time, they're looking at your coordination with the airway person that you're allowing them time to ventilate, right? They're also looking for your timing of that 18 seconds. So all of those are coming into play. That's why they're having you do 5 cycles. Make sense? Questions on CPR adult and the testing scenario. By the way, the testing scenario that I just described is the same exact testing scenario that you should replicate for exam day for the Massachusetts state exam. If you were following along, Station 1, right, I just went over the exact steps of Station 1. And you've already learned it. You've been practicing it the entire time. Yes?
And if the pads fall off the dummy when you're doing the compression, you just do.
They can't. On the day of the exam, you should have all new pads and a lot of new equipment.
Okay.
So if it does fall off, it won't be counted against you. What will be counted against you is if you did not place the pads in the correct position, even after they were asked. So let's say they're falling off, they've been hitting the floor a lot, and they ask you, where should you put the pads? And you go, center in the back. That would be what? That would be a fail, right? What if you say, it's supposed to be, yeah, that's right, you put it up here and over here. That again would be a fail, right? You need to place it where? Here and here. Makes sense?
And we are going to actually be using the sticky?
Correct.
Okay.
On the day of the exam, right, and on the exam here, you will be really using the sticky. The one thing I will tell you is that after you use the sticky, please remember when you're taking it off and resetting it, don't stick the 2 pads together. And also, do not take the pad off and then place it on the ground, so now it's stuck to the ground and now you have to peel it off the ground, because that also affects our ability to reuse it for everybody in the group. Any other questions on CPR? So we've done foreign body, so that's 4 stations already.